If you have depression, you may feel sad, empty and numb, or irritable. You may also lose interest in activities you once loved or feel constantly tired. Other symptoms include lack of sleep or drastic changes in your weight. You might find it harder than usual to concentrate, feel worthless, and lose hope that things will ever change for the better. The impact is often physiological as well. As the immune system weakens, you are more susceptible to migraines or chronic pain. Prolonged depression even leaves its mark on the mind. Studies suggest that it can lead to structural changes in the brain, including the shrinking of the hippocampus, a region critical for memory and emotional regulation. This can reinforce negative thought patterns, trapping you in cycles of pessimism. All of that can lead to withdrawal. Meeting people, once fun, can feel like an obligation. Some start to think that they are a burden to others and isolate themselves. Over time, it can escalate into profound indifference or a perceived inability to take any action, potentially stirring the darkest of thoughts. Your mental health is not a switch that flips between well and unwell. It exists on a spectrum. At one end, we have temporary dips in mood, a bad day, or moments of grief. On the other end, you feel so tired and hopeless, even basic things like getting out of bed feel impossible. Clinicians diagnose major depressive disorder when symptoms persist for at least 2 weeks and significantly disrupt your daily life. But a diagnosis is far from straightforward. Unlike a broken bone, depression and other mental health disorders lack clear biological markers. No scan or blood work can confirm them. Without clear markers, diagnosis depends on structured interviews, an inherently subjective process that can lead to misdiagnosis. One study found that 70% of patients diagnosed in primary care settings were classified as depressed, whereas bipolar would have been more appropriate. But even experienced psychologists may sometimes fail to distinguish between major depression, forms of anxiety, or other mental disorders. This is because most mental health conditions overlap, a phenomenon known as comorbidity. And there is an even bigger mystery: the origins of depression itself. For years, the dominant narrative was that depression stemmed from a serotonin imbalance. In response, pharmaceutical companies developed a range of antidepressants known as selective serotonin reuptake inhibitors, or SSRIs.